Good afternoon, Bermuda. Since the announcement of the end of shelter in place and the confirmation that we will adopt a phased approach to our reopening of our economy, there has been much speculation around when we, as a country, would move to phase 2 and what that would look like. On Wednesday, I shared with you that a cabinet subcommittee was formed to review our progress and to make a recommendation to the full cabinet on the timing in moving to phase 2. The cabinet will meet in special session on Sunday to confirm the full details of what phase 2 will look like and the new regulations that will put into place to ensure that we systematically open our economy, but the health and safety of our community remains at the forefront of our approach in any strategy that we execute. When we announced our multi-phase strategy, we laid out what each phase would look like. For phase 2, we stated that our intended expansion of services would include the reopening of retail establishments with strict physical distancing and limited allowance of personal services such as hairdressers and barbers with strict restrictions governed by the Ministry of Health and personal protective equipment use to be required. I can confirm that this list may be expanded and will perhaps contain some elements originally proposed for phase 3. What I have stated above, however, will be at a minimum of what Bermuda can expect to be the essential elements of phase 2. It is my intention that phase 2 will commence before next weekend, but this will be confirmed by the cabinet on Sunday and will be relayed at Monday's press conference. The Minister of Health will now present today's COVID-19 results and an update on the work being performed by her team in the Ministry of Health and also at the Bermuda Hospitals Board. Minister?
Good afternoon, everyone. Today there were 244 test results received by the Ministry of Health, and one was positive for COVID-19. As I indicated in the press release yesterday, Bermuda has regrettably lost another person to COVID-19, and my sincere condolences go to the family and loved ones of that particular individual. Bermuda now has 123 total confirmed positive cases, and their status is as follows. There are 45 active cases, of which 38 persons are under active public health monitoring, 7 persons are hospitalized, of which 2 are in critical care, and a total of 69 have now fully recovered, and the total deceased, as was reported yesterday, remains at 9. The average age of all of our confirmed positive cases is 60, and the age range of all of our positive cases is between 18 and 101 years of age. The average age of persons hospitalized is 76, and their age ranges between 68 and 89 years. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all local cases is as follows. 39 are imported, 72 are local transmission with known contact, 7 are local transmission with an unknown contact, and 5 are currently under investigation. While there are some cases for which a contact or a source has not been identified, this is not sufficient to constitute community transmission. Therefore, Bermuda's WHO assigned country status remains as local transmission clusters of cases. The plateau in figures shows us that as a country, we have done an excellent job of containing COVID-19. This is as good as an outcome as we could have hoped for in the midst of a global pandemic. It gives us confidence that the interventions that we have implemented have had a dramatically positive impact on our management of this pandemic thus far. However, we must not let this good outcome make us complacent. I reported our real-time reproduction number on Wednesday as 0.47. However, given today's recent cases, the reproduction number has increased to 0.99. It is still below 1, however, but the rapid increase is a stark reminder and a timely reminder of how volatile the reproduction number is in a tiny population such as ours. and why we cannot rely on it exclusively to inform all of our decisions. It also reminds us that we must remain scrupulous with our prevention efforts. This is going to be a long journey. It is up to all of us to make it through successfully. I will now provide further statistics regarding the hospital. To date, there have been 37 admissions for COVID-19 over the pandemic thus far. The highest number of COVID-19 patients that King Edward Memorial Hospital has had at any one time is 16. There have been no cases of COVID-19 at the Mid-Atlantic Wellness Institute. To date, 536 MWI and KEMH patients have been tested for COVID-19. All patients in 2 of KEMH's long-term care units have also now been tested. There have been 60 surgeries, and that includes emergency, urgent, and cancer-related, performed over the last 4 weeks, and 53 babies have been born between the 1st of April and the 12th of May. I would like to take this moment to pause for a moment and thank all of the BHB staff for their tireless work during this pandemic, not just regarding COVID-19 management and care, but also carrying out some of their usual duties under the most unusual of circumstances, and as we know, highly stressful circumstances at that. So thank you all to those persons that work at BHB for all that they do for our community. The Premier has already touched upon the issue most prominent in most people's minds right now, which is when will we move to phase 2. Understandably, everyone wants to know when government is going to progress us to the next phase. But I want to stop and pause for a moment to stress that this decision is entirely up to all of us. Bermuda, your actions decide for us when we will move forward, and the power to determine how quickly we progress from phase to phase is all within our own hands and our control. As such, I want to encourage everyone to continue to wear a mask if you are doing so, and if you are not, to please do so at all times when you are either not at home or you are exercising. Sign up to the healthiq.bm that we've spoken about. Practice physical distancing, which means putting 6 feet of distance between yourself and other persons, and frequently wash your hands for at least 20 seconds with soap and water, or use a hand sanitizer if there is no soap or water available. If we do not do these things, we cannot move on to the next phases. We want also to make sure that as we move on to phase 2, we want to do so safely. Because the real-time reproduction number can fluctuate, the Ministry of Health will be using a number of criteria or indicators to measure whether it is safe to proceed from phase to phase. We have proposed a combination of indicators to measure how we are doing with our preventions and capacity, and how we have done in minimizing COVID-19 spread. Behavioral measures that will be monitored will include face mask wearing, physical distancing compliance, the number of people reporting on the Health IQ, and the proportion of cases that can be linked to clusters. Performance measures will also be used to confirm that it is safe to move to the next phase. For example, the country classification must remain at local transmission or less, and there must be small number of cases reported, minimal hospitalization, and critical care cases. We will be sharing more of this next week after Cabinet makes certain determinations, as the Premier has already spoken about on Sunday. Additionally, the Ministry of Health is currently finalizing guidance for each sector's reopening. For phase 2, this includes guidance for retail establishments, personal services, and so on, which we will announce next week, as the Premier has indicated. And in the meantime, Bermuda, stay safe and stay well. And remember, phase 1 has not given us the green light to party. It was an amber light to proceed with caution. Let's show that we know how to prevent COVID in our day-to-day actions so that we can be ready and prove that we are ready to move on to phase 2. Thank you.
Thank you very much, Minister of Health, and thank you to your team who continues to work on the front lines to ensure that Bermuda remains safe. Now, we will have an update from the Minister of National Security on the flight that arrived today and on the work being carried out by his ministry, the Bermuda Police Service, the Royal Bermuda Regiment, and the enforcement activities that will take place this weekend. Minister?
Thank you, Premier. Premier, this afternoon, I had the opportunity to go to the L.F. Wade International Airport to watch as we welcomed 104 residents on the Travel Edge Delta Airlines charter flight. The flight included local students and residents, as well as individuals who have been abroad for medical treatment. As with the previous air bridge flight, strict health and safety protocols were followed at the airport to ensure the safety of our customs and immigration officers, as well as the persons on the flight. We also had support staff on hand from the Royal Bermuda Regiment, the Bermuda Fire and Rescue Service, Menzies, Delta Airlines, the Department of Health, and Skyport, the Durham team, to assist the returning passengers during the disembarkation process. As I stated earlier this week, unless indicated otherwise, everyone from that flight will quarantine at the government-managed quarantine facility for 14 days, except for persons who will be self-quarantining at home for medical reasons in accordance with the Ministry of Health. In that regard, I can advise that about 40 persons have been given exemptions to quarantine at home, either for medical reasons or due to the fact that they are under 18 years of age. Over the course of the next 14 days, the Bermuda Police Service will be carrying out community home visits on these 14 individuals to ensure that the quarantine guidelines are being adhered to. This afternoon's charter flight was thoroughly deep cleaned and it was sanitized and will return to the U.S. today with approximately 100 outbound passengers of varying nationalities. Amongst them are 3 inmates from the Westgate Correctional Facility who were incarcerated and will be deported back to the United States of America. I wish to take this opportunity to extend my appreciation to all involved for their dedication and their service in ensuring the safe disembarkation and embarking process of this flight. Special thanks to the Durham team, our local Delta Airlines staff, our Customs and Immigration staff, the Department of Health, Skyport, to the regiment soldiers, and to the Bermuda Police Service, who provided bus transportation for our returning passengers to the quarantine facility. As Phase 1 continues, the Bermuda Police Service and the Royal Bermuda Regiment continue their community engagement to ensure the regulations are followed. The Bermuda Police Service has indicated that they continue to observe broad cooperation from the vast majority of those in our community during Phase 1. Additionally, businesses are complying with the regulations, and the Bermuda Police Service continues to enforce the requirements for masks to be worn in permitted establishments and by drivers acting on their behalf. I must remind our local establishments, if anyone in our local establishments does not follow the guidelines and does not enforce the mask wearing procedures, they will immediately be shut down. Unfortunately, the Bermuda Police Service has indicated that over the last 2 weeks, 4 people were arrested for breaching the regulations and will appear in the not-too-distant future in the Magistrates Court. As we approach another weekend of Phase 1, the Royal Bermuda Regiment and the Bermuda Police Service will have resources in place to manage recreational activities and to ensure compliance with the regulations. In addition, mobile advisory checkpoints will be in place. As Bermuda continues to experience warmer weather, we are mindful that our residents will be taking to the beaches and water for recreational activities. Please note, the Bermuda Coast Guard will be out in full effect this weekend to enforce the emergency powers regulations, specifically as it relates to the restrictions to recreational boating activity. We remind the boating public that no more than 10 passengers are permitted on a boat, all of whom must be members of the same household. Again, raft-ups are prohibited, and the recreational boating curfew is 7 p.m., not 10 p.m. Today marks 50 days of the enhanced Coast Guard operations. The Coast Guard have provided tremendous service over this time period. The Coast Guard has stopped and engaged with 469 vessels. They average 3 patrol cycles per day. In collaboration with the Bermuda Police Service, they have executed 5 arrests. They have conducted 1 search and rescue operation and supported the Fisheries, Customs, and Bermuda Radio. Again, I urge the public to be mindful of the guidelines that have been put in place. Lastly, turning to the Department of Corrections. On-site inmate visits continue to be suspended. However, virtual visits and phone calls to family and friends continue. Non-security staff are returning to work on a phased-in basis. Department of Correction staff have taken advantage of the COVID-19 testing available at Southside, and some of our health services staff have been trained to conduct in-house testing. Next week, we will test all of the inmates at our 3 correctional facilities for COVID-19. Staffing levels have not been impacted, and staff continue to carry out their duties professionally. The department continues to ensure that every effort is being taken to mitigate any risk of COVID-19 affecting our staff and our inmates. Please be advised that there is an adequate supply of PPE kit at the Department of Corrections. And finally, as of today, there have been no confirmed cases of COVID-19 among staff or inmates. Mr. Premier, I'd like to give a correction. I've been informed that only 18 people have been given permission to quarantine at home on this flight. It is total, there's a 40 in total from all of the flights. So to be clear, Mr. Premier, that only 18 people have been given permission to self-quarantine at home on this flight. There is a total of 40 people in total that have been given the permission to quarantine at home, sir.
Excellent. Thank you very much, Minister, and much appreciated for that update. As Premier, I also have responsibility for digital services within the government of Bermuda. One of the most important factors to the continued reopening of the country is making sure that we're making effective use of technology. You would have heard the Minister of National Security speak about the government quarantine facilities operated at Bermuda's award-winning hotels. To ensure effective quarantining at home, right now, we're having to make use of the Bermuda Police Service, who go ahead and check to ensure that those things are enforced. But going forward, Bermuda will be procuring a technology solution that will enable strict enforcement of home quarantine. It is hoped that this solution will be in place within the next month so the government quarantine facilities may close. These new technology solutions can also support the move to regularly scheduled air travel, as persons will be required to quarantine upon arrival and will be able to be monitored via technology solutions. Related to that, I would also like to take the opportunity to provide the country with an update on COVID-19 related apps that will be key to our ongoing battle with this virus. It is very important to understand that COVID-19 related technology is a complex and evolving space. Of utmost importance in the success of any solutions we choose is community trust and participation. No matter how good the technology solution may be, if the community does not embrace it, then it simply will not work. Countries around the world are racing to pilot and test new and unproven technologies that can help address the challenges presented by the global pandemic. Bermuda is monitoring these efforts with a keen eye as to what lessons we can leverage, but the bottom line is this: we are not going to rush to a solution. There is no need to be the first in this particular instance. Unfortunately, on the market right now, there is no one single app that does everything, and as such, we are watching each country and the solutions they pilot for insights to guide our efforts. There are 5 core areas that we have identified in the COVID tech space. First, are leading indicators, which can help inform public health officials to the potential risk of the spread of the virus. Second, contact tracing, in terms of identifying individuals who are positive and may have been exposed to the virus. 3, contact monitoring, to be able to accurately monitor and follow the progression of those contacts to ensure they receive adequate care and take all possible precautions to prevent any possible future spread. 4, citizen and stakeholder feedback, to ensure the public are informed about the risks and actions they can take to mitigate them. Also, ensuring decision makers are informed with the right metrics to react quickly to any changing situation. And 5th is access controls, such as quarantine monitoring solutions, potentially to allow for quarantine to take place outside of a government facility, and also credentialing solutions to enable persons to have access to places of where they may be able to access. We are keenly watching Canada and Norway's Telenor, who have leveraged cell phone networks to provide anonymized information regarding the general movement of the public to understand the risks of potential spread. We have been watching the UK in terms of being a leader in symptom tracking to help provide predictive indications of trends of the virus, and the Health Council has launched healthiq.bm as our own version of tracking this information. If you haven't gone to healthiq.bm, please do so tonight. Everyone is anxious to move towards phase 2, but it's important that we take responsibility and do the things which are essential as we are still in phase 1. So please go to healthiq.bm. We have been watching Singapore, Australia, and the UK's pilot in the Isle of Wight in terms of their rollouts of Bluetooth contact tracing technology. These applications require wide community buy-in to be effective, and that requires extensive public education on what they are used for and why in order for people to trust them. We are conducting our own internal pilots of similar Bluetooth contact tracing technology. We are also conducting an internal pilot of GPS-based technology that can act as a guide to assist essential workers in logging where they go to better inform contact tracing interviews. The bulk of our focus has been on evaluating solutions developed in collaboration with top universities like MIT and Stanford, as these institutions are best placed to ensure privacy-first approaches. And I'd like to thank, because in this particular instance, it cannot just be the government itself. About 2 weeks ago, we reached out to the Bermuda First Technology Working Group for their assistance, and they have been very helpful in helping us to pilot these applications and do future and further research so that we may come to a technology solution quicker for Bermuda. And that is part of the necessary collaboration between the public sector and the private sector, which is necessary for us to make sure we get our economy back up and running again. On the digital credentialing solution, there has been a great deal of talk about the potential for COVID passports to reopen global travel. Additionally, there is conversations about credentials which may be used so persons who are able to go back to work can actually know that they have a credential on their phone which states that they are actually cleared to go somewhere or to or have completed any particular training which is necessary and responsible to be at work. This is an area we are exploring developments for, and this is an area that we are also exploring as a potential pilot opportunity for Bermuda to take a leading role. One of the biggest areas of focus and a source of particular public interest are the apps to support contact tracing. It is essential that there is a broad understanding of what these apps do, as many Bermudians have suggested that they simply will not use such apps or are hesitant. It is very important that people understand why they need to use these particular applications when they become available. Contact tracing is a complex process. When someone tests positive, their doctor is informed so that they can tell the patient. Then the contact tracing team reaches out to map who they know and who they were potentially in contact with. Those contacts are then informed and given instructions on how to mitigate risks. But it is important to note, as the Minister of Health had indicated earlier, that the contacts do not actually know who they were in contact with, as the person who may have been positive for COVID is kept confidential. The challenge is that this process of notifying contacts can be very time-consuming. Every hour that passes between someone testing positive and those that were in contact with them being informed increases the risk of spread of the virus. Bluetooth contact tracing apps can assist with this by greatly reducing this time and will be essential as we move to future phases. They can also assist with notifications of anonymous contact situations where you perhaps shared a bus or sat in the same restaurant as someone, but didn't know them to be able to inform contact tracers. However, it is worth recognizing that technology is not a perfect solution. It doesn't guarantee that you've been exposed and can only serve as a guide that you may have been. It is useful to greatly assist the efforts to mitigate the potential spread of the virus if you followed a prescribed procedure to reduce the risk. If someone you have been in recent contact with has tested positive, you can be informed instantly, enabling you to make the right choices immediately without waiting for a contact tracer to call you. This significantly reduces the risk that you can pass the virus onto a vulnerable family member or anyone else. While some persons are willing to receive notifications about potential risks in order to be more aware before they potentially visit and interact with family or friends, other persons are not so willing. The virus has introduced a great deal of fear amongst many in the community and a negative stigma around those who may test positive. Some individuals are best being carefully informed by a quality medical professional that they may be exposed so they can get the support and assistance they need to manage this information. Before rolling out these forms of solutions, it is critical that we ensure that we have public understanding and participation, as they require a significant proportion of the population to participate in order for them to be effective. As early first steps, as I mentioned before, we are conducting closed pilots to confirm that the technology works at solving the problems we've identified. Similarly, we'll continue to watch other jurisdictions to learn from their efforts and to react accordingly. We are also going to be rolling out surveys to gauge public buy-in and sign-up forms to gain support from the community in regard to expanded trials. It is also important to note, as we had a meeting on this with the Ministry of Health earlier this week, that any solution of which we are going to be used will certainly be run by the Privacy Commissioner to make sure that it meets the privacy requirements which are necessary to have public support. The success of many of these technologies rely on that support of the people and are an essential tool in allowing us to reopen our economy. They can help us to get people back to work and make our recovery and moving into other phases more quickly so that we can get our economy back up and running. I ask that everyone work with us by seeking to understand the role that technology has to play and the part that you can play in making sure that we can open up as quickly as possible safely. Technology can help us do that, and that is why the government is going to make investments in this area so that we can get our economy back up and running as quickly as possible. As a note, I'm pleased to announce that the public bus service will return on Monday, the 18th of May. There will be a press release going out later from the government of Bermuda today, which will give the modified schedule for the buses. It is important to note that the Ministry of Health requires that all passengers wear a face mask when traveling on the public bus and maintain a minimum of 3 feet distancing when seated. As a result, seating will be limited to a maximum of 17 passengers with no standing allowed. And the Department of Public Transportation will monitor the demand and deploy additional buses where possible on individual routes. Please note that before boarding, it is important that you do not board a bus if you are unwell or displaying flu-like symptoms such as a fever, coughing, or sneezing. Please reduce conversations with bus operators, and if you must converse, do so at the door. All passengers must wear a face mask, and anyone without a face mask will not be permitted to ride. Customers must sanitize their hands upon entry, adhere to the physical distancing signage when choosing your seat, and it is important also that healthcare workers do not wear their medical uniforms on the bus. Remember to travel only for essential purposes and never if you have cold or flu-like symptoms, sneezing, or coughing. Now is not the time for leisurely bus or ferry rides, so please continue to stay home as much as possible. The Department of Public Transportation would like to thank the public for their patience and cooperation as they help in keeping Bermuda safe from the spread of COVID-19. Bermuda, as we enter what we hope to be the last weekend of Phase 1, we must remain vigilant and continue to push forward with solutions that protect the health and safety of our community, while we work to put our people back to work safely. With the right tools and with your cooperation, we can have the courage to give our people the opportunity to once again earn a living and provide for their families. On Monday, we will provide the full details on the next phase, how that will work, and what that will mean for you and your families. This is a big step that we will take, a step into the future, and a step in moving us back to the new normal in this pandemic era. Yet I cannot express enough how important it is that we remain vigilant and keep discipline in the behaviors that have helped to achieve our success to date. As a country, we have done tremendously well, but it only takes a few of us not observing the rules, which will make us fall back very quickly. As you heard the Minister of Health say earlier, our R number, our real-time R number, moved very quickly from 0.47 to 0.99. And that is a reminder to all of us that we are far from being out of the woods, and it is important that we continue to wear our mask in public and to do what is necessary to reduce the transmission of this particular virus. It is important that we move together as one people with one vision and one common cause, and that is to keep our country safe as we move back to work. Thank you, and I'm happy to take any questions from members of the media at this time.
Good afternoon, Mr. Premier. Afternoon, all. First one here would, I believe, go to the Minister of Health. We've been told that a long-term patient in King Edward has caught coronavirus in the hospital. Can we hear anything regarding steps taken to keep COVID from spreading, patients from mixing with others, for example, during procedures such as dialysis?
Okay, thank you, Jonathan. As I indicated in the statement, there are 3 wards that are on the hospital that are for long-term care patients. 2 of them have already completed the testing. We actually haven't received the results as of yet, and I believe the 3rd one is going to be tested tomorrow, but I know it's certainly imminent that that 3rd ward will be tested, as well as the senior psychiatric ward at MWI. So those steps are underway as we speak. With respect to patients that are either in hospital or alternatively from the community getting dialysis treatment, all of the requisite protocols are being established and utilized, such as the proper wearing of PPE, the mask, gloves, et cetera, just to ensure not only the safety of the patients, but also the safety of the nursing staff that are helping to perform that dialysis procedure.
Thank you, Minister. One of our readers wanted to know of the total cases. Are you able to tell us, and obviously there's a privacy issue, but are you able to tell us how many are Bermudian and how many of them are guest workers?
That is a good question, and I don't have the answer to that, but I can ensure that when we do the next set of data, perhaps next week, we can break that out. But I do not believe, looking at my record, that that's been segregated insofar as nationality or place of origin. I don't have those details at that point.
Thanks. Again, a query from a reader who is asking, why is government allowing us to participate in antibody tests, but they're apparently not revealing the results? I wasn't aware of that, but a reader was told that they would not give the results to her. Is that the case? And if so, what's the rationale for it?
With respect to the antibody testing, at this point, the results of the testing are being utilized to assist us with data so that we can see from a country perspective where we are with respect to COVID. The antibody testing, as you can appreciate, the serology testing is provides information as to whether or not that person has been exposed to COVID. So utilizing those testing is to assist us with respect to data collection and to see to what extent the population has been exposed to COVID. So it's more for data collection at this point. Right. The testing procedures with respect to ensuring as best as possible whether or not the person has tested positive, the gold standard is the PCR test.
Thank you. Yeah, but yesterday's reported death, the turnaround of that one was quite striking. The patient was confirmed the day that they passed. Are we seeing a case that shows, again, cognizant of privacy, but shows how fast vulnerable patients can succumb after they have shown symptoms? What made this one so different from the others?
That's a good question, and I thank you for your consideration with respect to the confidential nature of these matters with respect to persons' privacy. I can only report at this point that that matter still is under investigation, and so there's no further details that I can release at this point of time simply because they still are investigating that case.
Thank you, Minister. Minister Keynes, this looks like one for yourself. We are hearing stories that the financial waiver for quarantining, the government quarantining, is being inconsistently applied. Some people get it. Some people say they pleaded that they're broke. They got the flight on their last dime, and yet their plea for a financial waiver got rejected. Are you aware of this? Will you be looking into this?
This is a human exercise. People are given a form, and they fill out the form. The form is looked at by people within my ministry, and they make a decision based on a matrix that they use, based on a matrix of need. Sometimes when they look at the need of the person, some people have qualified and some people have not qualified. It is indeed a difficult perspective. You have a limited amount of people on the flight. Some people that you obviously are students and their parents are impecunious and that they want to return home. They have been abroad for a long period of time, and so we have to look at a number of things. It's not just the cost, how long they've been traveling, what the personal circumstances are, and there are a number of things that we use to make that decision. It is unfortunate, but not everyone has been allowed to come on. Each one of these flights have had people that have not been able to be on the flight. We have people that have been given exemptions, but we make that decision based on all of the information that we have in front of us. It is not an easy thing to do, and it is a difficult decision to make when you're saying that some people can receive some people can receive an exemptions and others do not receive it. It's difficult.
Yeah, I mean, these are people that are saying they said they were broke. It's hearsay, obviously. I don't know. The
reality of it is, this is a process that we understand that people are saying that they are broke. We are looking at it as best we can. It is so difficult that sometimes people are said yes to, and sometimes people have said no. It is as fair as it possibly can be, and we wish that we can have everyone that's coming in from a city get on the flight, but you just cannot do that. That everyone can get the exemption, but you just cannot do that.
Gotcha, sir. Thank you. Lastly. Yeah, I mean, we're still continuing to hear folks who are not receiving their unemployment benefits. Obviously, as I said last time, we know this is a new thing. We haven't done this before. But there are some pretty dire stories coming in. Can we check how many people, even if it's a ballpark figure, still haven't been paid? Or if there's a reason why we're being prevented from being able to gauge the number of people who just haven't been able to get their pay yet?
Jonathan, I don't think there's any particular reason that we haven't disclosed those particular numbers, and I would say that I think it's a matter of being imprecise. The fact is that if anyone is approved, they are paid, and I think that there are particular individual challenges. The Minister of Finance was here on Wednesday, and it indicated that in some instances, because of some duplicate errors, et cetera, there were persons who were paid more than once. But I think the minister has been very clear that there is a large number of people that are working on those processes, and persons who have not particularly been paid are getting these levels of are getting payments. Now, well, here's what I will say. I'll say that as long as someone who is expecting to receive these benefits is not receiving these benefits, it is a problem. But I also want us to recognize that a significant majority of the persons who have applied for these benefits have received these benefits. Persons who have not are going to the Department of Workforce Development on a case-by-case basis. Some of them are contacting my office and ministers directly, and we're doing our level best to make sure we give them assistance. The Minister of Finance has been very good in making sure that emergency payments can be issued for these persons so they're not made to wait for a number of weeks. And I am satisfied that the department is continuing to press on. Just the exact same way that you're hearing those particular horror stories, I have heard some of those horror stories. And when those horror stories are brought to us, we make sure that helping agencies can get to these persons, can deliver food so persons are not hungry, and we can make sure while we work on their particular benefits. But the other thing is, Jonathan, that it's important to note that not everyone who gives the story is actually eligible for these particular benefits. And so there are some particular cases where we have found that persons have made these levels of complaints to our office, and upon further investigation, it turns out that the facts of which they're relaying are not true. So it is a difficult situation, but I think the Minister of Finance has stated that I think over yesterday and today, an additional $7 million was paid out. There's a significant amount of money. I think they're moving to payments not going from every 2 weeks now to every week as persons get back to work. It is a process that is continuing, but I think by and large, with the level of support of which we've been able to deliver to the community, it has been significant. But as I said, if there's one person that hasn't received their benefits, it's one person too many, and we continue to work on those individual cases to make sure that there's as few as far between. But as the Minister of Finance indicated, and this is important to note, if you were eligible, you will get your funds.
Thank you, sir. And we have heard from people today as well who were happy to get their funds. So there is also that. Thanks.
Yes, good evening. Minister of Health, you've just confirmed 123 cases here in Bermuda. Are you alarmed that the numbers are still going up, and do you think we've peaked yet?
Well, I'm not sure alarmed would be a proper adjective that I would use, but of course it is concerning to us as a country and certainly as a government when we see more increases of COVID-19. However, we also recognize that we are in the midst of a pandemic. Our modeling that was reported a couple weeks ago indicated that our worst case scenario at 2.4 R naught value would see over 700 persons deceased. And the amount of persons accordingly would have been with respect to how many people would have been affected. I think that what I'm pleased to see is the fact that we have proper non-pharmaceutical interventions that we've all lived through, such as the shelters in place and the masking and the physical distancing mitigants that are in place. And I'm encouraging persons to continue that so that we don't see a curve, so to speak, a spike that will no doubt adversely affect and compromise our healthcare system. We recognize that we're in the midst of a pandemic. We recognize that we will see positive cases, and regrettably, we will see people that will succumb to those cases. However, we continue to do what we've been speaking about with respect to the mitigants, then we will not see, it will be less likely that we will see this uptake surge that will overwhelm our healthcare system.
Thank you, Minister of National Security. With buses about to hit the roads on Monday, will there be security or anything that's going to keep order for these drivers when they navigate different passengers?
It's a very good question. In the city of Hamilton, there are places in Bermuda that we can describe as hotspots. One of them will be at the bus terminal. We will ensure that at the requisite times, at the peak times, we will have members of the Bermuda Police Service or the Royal Bermuda Regiment at those locations. As you know, the buses will not be driving at capacity. Whilst we will not have police officers at this stage on each bus is equipped with a radio where they can ask for help, and the Bermuda Police Service are indeed mobile and will be able to respond to any situation as the need requires.
Premier, I've been approached by a few seniors just today, and they still have not received their pensions for this month. They are somewhat concerned that some of them do have projects and they would like to draw down on their pensions. Is that possible?
Okay, I'm sorry. Now you've asked two different questions. You've asked
Some
seniors
of them
that
haven't
weren't receiving their pensions, and then seniors who
And then others.
I'm not understanding. So try to just give me the question again so I can make sure I
you
get the
have-
right answer.
I was approached today by a few seniors that have not received pension at all for this month. what seems to be the delay?
The first thing is I think that pensions are paid on the 15th of each month, and that's today. So they wouldn't get the payment before today. Pensions are paid on the 15th of the month.
Okay, I'll leave that one just where it is. Another question for you, Premier. With the news we disclosed this week, particularly the request by the Bermuda Hotel Association to have the Labor Act amended, could you give us an idea of what it would take to make such an amendment in the immediate future, or what would it take for the government to consider such an amendment?
An amendment to law has to pass through the House of Assembly, the Senate, and be signed into law by the governor. So that is the process by which any law changes are to be made in Bermuda. Regarding the specific request of the Bermuda Hotel Association, I have expressed my extreme displeasure to Bermuda Hotel Association because I do not believe inside of this particular situation that we should be attempting to negotiate in public. A letter was sent to myself. That letter was for myself. I did not see a CC to the Royal Gazette, TNN, Bermuda Broadcasting News, or anyone else. And I would just serve it as a warning that during this particular time, if we're attempting to negotiate in good faith, I do not believe that the way to negotiate in good faith is to try to do that during the press. I also do not believe that hotels that have been the recipients of massive concessions should try to tell the Minister of Health that she should be cut off and the funds from the hospital should be cut off in that particular regard. So we have taken those matters into consideration. The Minister of Tourism has had conversations. The Minister of Labor has had conversations. The Minister of National Security has had conversations. And we will advance those particular matters. But just in the same way and instance that it seems that members of our Public Services Union want to try to start negotiating in public as well, we're not going to do that. That is not the way that we can be constructive. Every single person inside of this country has been affected by this pandemic. Every single industry has been affected. And we are going to make sure that we are as fair as possible across the board. But I would urge the Bermuda Hotel Association, if they are looking for particular items, to keep letters of which they've sent to me, which are under the active consideration of Cabinet, and not CC'd to the media, to keep them private.
Good stuff. Over the past week, we have heard voices of industry businesses, and they have sounded the alarm and said future of many businesses look bleak indeed. What would your message be to the businesses and of course, the average Bermudian who fears mass unemployment?
The message is that the government is determined to reopen the economy as quickly as possible. And that is the reason why we're meeting this Sunday and we'll be announcing items on Monday. And that is why I said inside of the statement that we might even consider in putting towards Cabinet, because Cabinet is the only people who can make that decision as they implemented the decision for the phase timeline, to possibly move some activities that were in phase 3 into phase 2 so more persons can get back to work. As the Minister of Health has indicated, I think it is a great thing when we've seen that the hospitalizations in our hospital have gone down from 16 to 7. I think that it is a great thing that we've seen in a number of persons who have been discharged from the hospital. I think that it's great to see that the number of new cases has been below the 7-day moving average, has been below 1 new case per day for a significant, since the beginning of this particular month on that moving average. So I think that we are making progress. And I think, as I've said before, Trevor, and it was a question in which you asked the Minister of Health, asking about whether or not we've reached the peak. The policy of the government of Bermuda is not the complete elimination of the virus from these shores. In order to do that, we will have to inflict massive and continued economic pain and suffering on this country, which may have more persons die from the economy than die from the health effects of the virus. Our job is to balance those two particular things. And so I think that we are going to balance those things and move towards reopening. So when you talk about the things which are included inside of phase 2, the reopening of retail establishments, the reopening of personal service establishments, I think that it is a significant amount of activity where you'll see more persons that are able to return to work who are not able to work previously. And that is the way that we're going to do. So when I speak about technology solutions, which are of help, when I speak about the fact that people have to maintain what it is that they're doing right now, make sure that they're wearing their masks in public. All of those things are what is necessary and required to get us to open back up as quickly as possible. I want to get our tourism industry back up and running. There are some islands to our south that are actually looking at opening their tourist industries back up in June. Do I think we're going to be opening up our tourist industry in June? I don't believe so. But with a combination of technology and other things, we can begin to see some form of economic activity as long as it's safe. That is the reason why we had discussions with advisors to the Ministry of Health yesterday to figure out what are the new testing modalities that are coming online, what are the things in which we can use. So as the technology changes, the government is making sure that we're keeping abreast of those latest technologies so we can put those things in place to get us back to work. So for the persons who are fearful of a long-term economic slump, rest assured, Trevor, I am just as fearful. And that is why we are very aggressive in our efforts to make sure that we're doing across-the-board testing in this country and to make sure that so we can minimize the transmission of the virus so that we can reopen safely.
Thank you, Mr. Premier. That ends my questions.
Don Burgess, Bermuda Broadcasting. Active local infections peaked at 65 on April 25th and declined for 2 weeks until May 8th, meaning people were either recovering or passing away. However, for the past week, infection rate has remained static. We've seen several new cases emerge and several deaths this week. We're not seeing people recover this week. Based on the infections, when the infections took place, we would have expected to see a lot more patients recovering by now. Why is this?
Thank you for that question, Don. Let me refer to my statement real quickly. I think the important point to note out is that of the 123, Don, total confirmed positive cases that Bermuda has seen for COVID-19, 45 of those remain active. Of those 45, 38 are on active public health monitoring, and 69 have recovered. So I'm not a mathematician. I studied law for a reason. I think that's about half. So at least half of those persons that have been diagnosed as positive COVID-19 have fully recovered. I think that's a tremendous indictment on what we're doing in Bermuda, not only for the care that's being received in our medical community in our hospital, but again, as I said to Trevor, the fact that we have all of our non-pharmaceutical interventions to help to minimize how many persons are affected by COVID, such as mask wearing, physical distancing, and the like.
You just mentioned masking, and all three of you tonight have emphasized the people wearing masks, but we're still seeing people out in public not wearing their mask, and you've emphasized again that in public, when they're out of their house, they should. How much more can we just try to get this message home to people that they need to wear them?
That is a very good question that warrants repeating. How much more do we need to do to get the message across? I think it can be answered in twofold. One is, like we spoke about, we're going to have indicators as to what we will look at when we go from phase to phase. And one of the indicators, lead indicator, is what are we observing insofar as how many people are complying with that requirement to wear face masks in public. And if it seems that that is not being adhered to, persons and people in the community that are choosing not to wear masks, then we should all be looking at them, because if we don't graduate to the next phases, we can point our finger to the persons that have not been compliant to the reasonable request to protect yourself and to protect others by simply wearing a mask.
Thank you. Are you aware that there's still persons in Bermuda awaiting test results stretching back more than a week? We heard at the EMO meeting on Monday and Wednesday that these problems had been ironed out. Do we know why people are still having to wait so long for the results? And is this not a danger to slowing down further spread in the community?
Well, you would have heard the Premier mention on Wednesday that there is a new protocol that's been established with respect to the computerization. The self-referred bookings are sent their results via email between 24 and 48 hours of testing. Physicians will then have a unique portal with unique logins, which will only display the results of those who were referred to as their doctor during the registration process. And of course, epidemiology and surveillance unit will continue to receive the results for on a daily basis. And the doctors will now, moving forward, not have to search a database for the results. They won't have to call patients for the results or wait for the lab to send the results, and that solution is being delivered and help to alleviate the burden that the doctors may have insofar as allowing for a quicker turnaround time with respect to getting the results from our government lab at Southside.
Okay, thank you.
If I may say and add something else there, Don, I think that it's particularly important to note that there could be a number of reasons. But one of the things in which you said inside of your question was, is this a danger for the spread? I can assure you that anyone who is test positive is instantly informed. ESU is instantly informed, and those things are handled in a different fashion. When we're talking about the drive-through testing, I think that out of the significant over 2,000, probably close to 3,000 persons who have been tested through that process, through the drive-through testing specifically, there's been a very low number of positives, and those positives have been informed quickly. But just as the instances of which we'll have with persons who may be not receiving their unemployment benefits, there are certain errors that can happen. So, for instance, some of the issues with unemployment benefits were people were putting the wrong bank account number or messing up a number on their wrong bank account number, which was leading to this. There could be another thing, because you heard me say on Wednesday that anyone who's at a test, the drive-through facility, was emailed their results. If their email address is incorrect, then that email address may not make it to them. But the information of which was given at the press conference was that any single person has gotten their results. And what I will do is that prior to the end of this particular matter, I will find the email for that lab, so anyone who hasn't gotten the results can go ahead and send an email so they can get that particular issue resolved. But I know that communication went to all doctors on Wednesday following the press conference, and I do know for a fact that the system has been upgraded and persons have been emailed their particular results. But anyone who would have tested positive would have been informed that messages sent immediately to ESU, and those particular items are acted upon. So I do not believe there is, as your question said, a risk for the spread of the virus in those particular cases.
Thank you. That's very helpful. Health Minister, yesterday you said it was timely to remind residents of the importance of protecting people who are extremely clinically vulnerable because of the coronavirus puts those with other health problems at particularly high risk. In light of the person who unfortunately tested positive yesterday and also passed away, what should family members and friends be doing for those who are in this vulnerable position?
Thank you for that question, Don. I think it's important that as we continue to attempt to, as best as possible, shield those persons that are most vulnerable in our population, we can be accommodating and assisting. We can assist with respect to doing their grocery shopping. We can assist by picking up their pharmaceutical supplies or any other personal supplies that they need so that they have an opportunity to stay home. As the Premier indicated when he was speaking about the resumption of the public transportation through the buses on Monday, if you don't need to go out anywhere, then you need to stay home. And likewise, those most vulnerable persons in our population, we should be shielding them as best as possible. And if they don't need to leave because they'd have to go to the grocery store or get pharmaceutical supplies, we can assist by helping our loved ones and our neighbors and those persons to minimize their contact with individuals. Likewise, if we go and visit those persons, we can drop off the groceries at their doorstep. If we happen to go in there because we're visiting them for whatever reason, we need to make sure that as much as possible when we're in the public domain that we can exercise our 6 feet of physical distancing, wearing our mask. If we're going into those persons' houses for whatever reason, and it should be something very extreme, then we make sure that we continue to operate with physical distancing with them, washing our hands frequently, utilizing hand proper hygiene and so forth. So we can minimize the impact, but it's really, really important that we try to shield those persons. And in doing so, that means that we may have to extend a hand of fellowship, so to speak, and assist them as possible with respect to their day-to-day needs.
Thank you.
You're welcome.
The overall numbers are trending very positively for Bermuda, but with this person who passed away yesterday, what pause does it give to consideration of moving to phase 2 when the contact tracing hasn't been done since it was just a sudden case? The consideration, I think, only speaks to the fact that our RT factor that I spoke about during my statement, because we've had 2 deaths since, I guess, Tuesday or Wednesday, it affects our RT number, which is still below 1. But the reality of the situation is, like I said, that particular case, we are still doing the investigation. So part of that investigation would, as we've spoken about previously, always does involve contact tracing. But it's far too early to be able to provide any details to the press, because this is just a very new case that was diagnosed, that was revealed yesterday. Thank you. Mr. Security Minister, With the 40 people for the flights that have been given exemptions, can you break them down into what particular categories they fall into?
I can.
Just so we're clear, exemptions which are given from home quarantine are under the domain of the Minister of Health.
Sorry, thank you.
That's fine. With respect to home quarantine, as the Minister of National Security indicated in his statement, persons that are required to quarantine following the COVID-19 travelers regulation that was entered into several weeks ago, any persons that arrive in Bermuda are required to go to the government quarantine facility for a period of 14 days. Except for two categories of persons. One, minors. It only relates to persons that are under the age of 18. And two, persons that have received a medical exemption signed by the quarantine authority, which is myself. In order for me to provide that medical exemption, I require medical certification from their physician, from their surgeon, et cetera, to confirm the need for them to quarantine at home as opposed to in the government quarantine facility. And I can tell you, for this particular air bridge, there are 18 persons that were approved for a medical exemption, and 6 are minors. 2 are wee little babies.
All right, thank you very much.
John, if I may just add one thing, because I just received a particular email, and it had said that yesterday, this is a real-time story, somebody went to the drive-through testing facility at 2:30 p.m. yesterday and received an email at 12:45 a.m., so within 10 hours, confirming their negative test result. So the new system is certainly working.
That's fantastic. Thank you.
Awesome. Good evening, everyone.
Ms. Palacio.
Maya Palacio here for Media Maya. My first question goes to Minister Keynes. I asked this question maybe 2 weeks ago, but what are the updates on the 24-hour shelter in place at Cedar Bridge? Is it still operating, and is there a plan put in place for those persons?
The shelter in place is no longer. The good news is that the community shelter is still operational at the Cedar Bridge Academy. It is a shelter that is from the night until the morning and is no longer during the day. During the day, the gentlemen and ladies are allowed to be out in the public domain. They're giving a packaged lunch, and they indeed come back at night.
That's great. So is there a plan put in place for afterwards for those persons when
you say a plan in place, what do you mean?
When you mentioned about 2 weeks ago about all the great work that Cedar Bridge is doing, and that you would love for those persons to continue on after and be able to be filling citizens in the community, and also be able to gather jobs and things like that, and have all the needs that Cedar Bridge is giving them right now in terms of medical care, like therapists and everyone being there for them. Is that still going to happen for those persons?
I think we're, as a country, we have a challenge with unsheltered Bermudians. This is something that has been exacerbated because we had a lockdown, and we as a country knew that we did not want our most vulnerable people just left on the streets. And so we put a plan in place immediately, and it first was at the Barclay Institute. The Barclay Institute was not perfect for them, and so we went to the Cedar Bridge Academy, and at the Cedar Bridge Academy we noticed that some really smart and wonderful things started happening. People were no longer, they were having the opportunity to wean off of drugs, alcohol addiction. People were getting square meals a day. We saw the benefit of having drug counseling there and mental health counseling there. And as a leader in the country, I shared with the Premier and my cabinet colleagues that we got and we saw some wonderful green shoots of hope. I've had the opportunity to speak with some community stakeholders, and we indeed have a long-term strategy. But Maya, this is not something that is going to happen overnight. Mm-hmm. We have people at the Salvation Army that have a long-term plan. We have a number of people in our third sector that are feeding people all across the island. Our country is going to go through something that heretofore that we haven't seen. It is our responsibility to look out for each other, whether it's civically, whether it's socially, whether it's through our churches, and put together a plan that the entire country can evolve through this. As it pertains specifically to our unsheltered population, there was a specific cohort of people, including the Corporation of Hamilton, the Department of Health, and other entities that have been working on a strategy. This has given us the opportunity to say we need to continue this work because it's good work to help the people, the unsheltered population in our country.
Thank you. And that actually leads to my follow-up was that if there is, if the if people in the community could help and assist with that, who can they contact?
I think we have the opportunity to reach out to people in the third sector. We have the Red Cross, we have the Salvation Army, the Seventh-day Adventist Church. There are a number of people that are doing things generally, and if people in our community want to help, they can reach out to any of the aforementioned entities and donate time and donate effort, donate clothing. And so we have so many different ways that Bermudians, or anyone for that matter, can continue to help those who are most vulnerable in our community.
Thank you very much. My next question. I know I've asked this to you before, Mr. Premier, but since Wednesday's press conference, I've had a total of 6 different persons ask about if there's going to be any more flights for Bermuda residents coming from the UK.
UK?
Yes, from the UK. Can you answer that as to if there will be any more flights?
There is no further news on flights, whether they be from the UK and or from Canada. It is likely that the next flights from the UK and or Canada will be when regularly scheduled air traffic resumes. We are uncertain when that may take place. As I had indicated earlier regarding Canada, we do know that there are still students that are stranded in Canada, and we have asked that persons make sure that they go to the government, the website coronavirus.gov.bm, and if they have not yet already registered their information, to go ahead and register themselves there so we can have an idea. We're trying to figure out if we can get a flight from Canada, one more, and if there's enough interest for a particular charter flight. Regarding from the United Kingdom, there is no plans for another airbridge flight from the United Kingdom. So the next flights to and from the United Kingdom will most likely be when regular scheduled air traffic recommences.
Thank you very much. Minister Keynes, why were 3 inmates permitted to travel back to America today?
They were not permitted to travel back to America today. They were deported. Both of them had served a period of incarceration. And at the end of any period of incarceration, the Department of Immigration deports the people back to their country of origin. It just happened to be an opportunity on this occasion for us to deport those men because we had a bridge flight, because we had a charter plane, and it actually made perfect sense. They had very little family in Bermuda, financial means to support themselves, so it made really good sense to put them on the charter that left Bermuda today.
Okay, great. Thank you so much for that. And Mr. Premier, what solutions, if any, will be discussed in the Cabinet about services of possible daycare or summer camps for persons who have children, and if Phase 2 does reopen, need their children to be watched over in some way and form? Will that be discussed?
I'm certainly not going to discuss what may or may not be discussions in Cabinet, but what I will say, Maya, is that we are perfectly aware of the difficulty, and me being a father of young children myself, the difficulty of persons going to work without childcare. And that was the reason why Phase 3 had an overall, that's the reason why Phase 3 had returning to work, schools, and government at the same point in time, because it's difficult for people to return to work without childcare. But those particular concerns have been discussed, and those particular concerns will be considered as we look to move forward. I think there's also a question as to whether or not we can learn. And, we might not do everything that's in Phase 3 and Phase 2, but we might do some small pilot programs to have a better understanding of how things may work better as we move into Phase 3. So those are the matters that are being considered, and I want your readers to know that I certainly have heard the concerns which are being expressed about persons who may be returning back to retail, or persons who may be returning back to personal care services, and the difficulty on the provision of child care, and not wanting to leave their children with elderly family members, et cetera. And those matters are certainly top of mind.
Thank you very much. And Mr. Premier, you mentioned that there will be an investment in the application and the apps that you were talking about earlier today.
Absolutely.
So my question is, if there is any money involved, how much money is being invested in that project?
I can't tell you how much money is being invested, but what I can tell you is that whatever money is being invested will pale in comparison to continue to pay people to stay at home. And I think that's the important trade-off which the government of Bermuda is making. So whether it's the operation of quarantine facilities, or it's the operation of all of these particular items, now is the time to begin to wind back where we are. We have, declining hospitalizations. We are making sure we're doing our best to surveil the entire population. We have a large-scale testing program that's in place, and we're going to, and as long as we have public cooperation in regards to persons wearing masks, et cetera, then that's helpful. But what we will have is we have more movement, and we move on to phases like 3 and phase 4. The fact is that we want to be able to quickly track down any clusters of cases, should clusters of cases emerge, because as we said, it is very difficult, especially with a virus like the novel coronavirus, which has so many asymptomatic carriers. It's just very difficult to stop it. So we certainly managed to slow down the spread, and we're going to continue to do that. But the technology solutions will be certainly very helpful. And I think that if we make, let's just say, for instance, it costs $1 million. I think that $1 million is far better investment than $7 million a week to pay people to stay at home. And so I think that we're looking at it inside of that aspect. And now that now that we are where we are and looking to move forward to other phases, I have certainly turned the attention of the technology teams inside of government to making sure that we can have these technology solutions. And so, again, I want to thank my Chief FinTech Advisor, Dennis Pitcher, the FinTech Business Unit, who has been working on assisting with this as well, the Department of Information and Digital Technologies, and Mr. Martin Walsh, and also the Bermuda First Technology Committee, and the teams also at the Ministry of Health, as we continue to work through these processes to make sure that we're able to roll out these technology solutions, which are going to be very necessary as we move to future phases, so that when and if there is a new cluster, we can quickly track that cluster and make sure that it doesn't spread into something larger, which will cause us to move back into, to roll back the phases and to put on more restrictions, which I think are more damaging to the economy.
Thank you. And with the applications, is there a concern that those who are like high vulnerability, which is the seniors who don't have the smartphones to have those applications, would that in fact any numbers or any results from the application?
I think it could, but I think that I don't sell our seniors too short. One of the things as the minister responsible for IT, I get to go to the seniors and internet days and all the rest, and we know that a lot of our seniors use their phones, and use the apps on their phones, et cetera. So I think on an overall basis that usage will be good. But for persons who are supposed to be shielding seniors who are vulnerable, whether they have an app or not, the app isn't going to protect you. And so I wouldn't advise those persons who are supposed to be shielded to leave if they don't have to leave for any particular purpose.
Thank you. And my final question is for you, Minister Keynes, about Cheval Dillon Burgess. I know I asked again on Wednesday, but is there any other updates or call to action for the community?
Maya, I'm actually glad that you ask every day about Chevelle. I think it's important as a country that we do not rest until she's found. I would say that the Bermuda Police Service are deeply in the throngs of an investigation. The Commissioner of Police has a team that has been assigned to this, and they're working feverishly on a number of different lines of inquiry. At the appropriate time, if there is more information, I will make the information available through this forum. I would just like to remind Bermudians, though, and share with you, there are a number of just everyday Bermudians that are in the community on a regular basis looking out for her. I received a request today for people to go out in a boat because they're not from the same family, to get an exemption so they can go out in the water at specific locations and look for her at this weekend. And so the country is not happy, they're not at ease with the situation, and every day we're receiving so many people coming to us just saying, what can I do in my neighborhood with my friends to look for it? So there are a number of people that are out looking. There are people that have information. We're going to ask people that if you have any information to call 295-0011 or the other number for the Bermuda Police, 211, and just share any information that you might know.
Thank you very much. Those are my questions.
I do appreciate that. I'm involved in a bus driver's chat, and they are extremely alarmed and they're trying to find out why and where did the 3 feet distance come into for these buses. They're in an enclosed area, and they are saying that you go to the grocery line, you got 6 feet. So they're extremely concerned that they're going to be challenged with such a small area inside this coming Monday. How do you comfort them?
Thank you, Trevor, for that question. That's a very good question. And recognizing that we have been speaking about social distancing of 6 feet. However, what we did at the Ministry of Health is we did look at international best practice and what other jurisdictions who have also successfully maneuvered through this and opening up their public transportation have also done. And what we have found is that the critical element is the wearing of the mask, and that they have also allowed for 3 feet of social distancing to take place with a maximum number of persons on the bus. So you've heard the Premier indicate it's 17 maximum. So in many instances, it may actually be a little bit more than 3 feet if you think about how many seats are on a bus. So we did look at best practice internationally and felt that that would be sufficient for the circumstances here in Bermuda.
Thank you very much.
Trevor, you got a bus driver chat on your phone too? My, you got everything.
Yes,
Didn't
sir.
know that. I didn't hear the hospital, but you know a lot. Well, here's what I'll say. There's just a few things that I want to give to the country before we close out, and I wish everyone a good weekend. You would have heard my statements earlier regarding the Bermuda Hotel Association and the desire for us not to negotiate in public. Unfortunately, prior to this press conference, I was also made aware of an email which was sent out from the Bermuda Public Services Union, and a lot of persons contacted me with particular alarm inside of what was revealed in that particular email. We are in a very tense phase right now in negotiations with all of our public sector unions. The Minister of Finance was very, very clear in regards to the financial situation of which the country finds ourselves in, and we all have to make sure that we are making sacrifices. It is my view that the proposal of which was put to all of the public sector unions, which I would have expected would have been in some way, shape, or form kept in confidence, so it did not make it to the media, so we had to start receiving inquiries about those particular instances, was something that was fair and something that was equitable. It was a one-time emergency item that would have not reduced the take-home pay of public officers in this particular year, but would have provided significant savings to the government of Bermuda so that we would have been able to combine save $150 million inside of this budget year in order to meet the Minister of Finance's deficit targets. We are going to continue to negotiate and discuss inside of good faith, but the fact is that this virus is going to affect our economy, going to affect government revenues, and we want to ensure that we continue to provide government services in the way that the country has become accustomed to. There is a very easy target that a lot of persons have when they look at the government budget and they say, why are we spending all this money on grants and contributions? Let's be clear. The largest portion of grants and contributions are money that goes to the hospital. And cutting back on grants and contributions means that we're cutting back funding for the exact department that needs more resources. The second largest matter inside of grants and contributions is financial assistance. And everyone will know that there's most likely going to be a higher demand for financial assistance after the unemployment benefit runs out. The third largest item inside of the grants and contributions is grants to aided schools and the Bermuda College. And there will be savings that are going to be made across the board when we go through these particular issues. But I do not believe that it is fair and proper for persons, when we're engaged in a conversation and discussion, for persons to say that there were not enough savings that were done from that particular purpose. We've gone through a collaborative process, and what I will say to the country right now, and what I would say to the leaders of Bermuda's public services unions, that we will continue to negotiate in good faith, but I would ask that the negotiations be done in private and not inside of the media. It will cause us to make this situation more difficult, and right now, what the country needs is for us to be unified, for us to make sure that we are all recognizing that we have a particular role to play, and so that we can come through this crisis together. If we begin to start falling apart now, the next few months and years will be incredibly difficult. So I urge that we will all make sure that we maintain our decorum, and if there are thoughts or communications, that we try to keep them out of the public sphere so that we can arrive at the best solution for the entire country. This weekend will likely be our last weekend in phase one, so I'm going to remind persons that they have to continue to observe the rules of which we've laid out if we want the cabinet to make a decision to move us to phase two. It is very important that we continue to follow those rules. With that, I wish you and your families a very wonderful weekend, a safe weekend, and I wish that everyone, and I thank, I would say, my cabinet colleagues, all of the persons who continue to work in government, all of our wonderful public sector workers, all of those persons who are working on the front line inside of this healthcare crisis and continue to deliver services day in and day out. And with that, thank you and good night.
The month of May is Heritage Month, a time when all Bermudians have the opportunity to celebrate our people, culture, and history. However, because of the COVID-19 pandemic and in the interest of the health and safety of Bermuda's citizens, the Bermuda government made the decision to cancel Heritage Month activities, including the Heritage Day Parade and the May 24th sporting events. In an effort to help our viewing audience observe the occasion of Heritage Month, CITV will air a series of programs that capture Bermuda's history and cultural heritage. Many of these programs were produced by well-known local producers and production companies, as well as CITV. We invite you to join us and watch past Heritage Month events, including the 1987 Heritage Day Parade, The Road to Glory, a documentary on the history of the May 24th Marathon Derby, and the 2006 May 24th Sports Highlights program, including the Sinclair Packwood Memorial Cycle Race, as well as the Junior Road Race and the Half Marathon. Each week, the TV schedule will be posted on gov.bm, and the schedules can be seen periodically throughout the day on CITV. Watch us on One Communications Channel 2, WOW Channel 102, Digicel 2, and Blue Wave Channel 2, and also streaming live on gov.bm. These programs, along with many more historical and cultural documentaries, will be aired during the month of May on CITV.